Next presenter. Presenting author is Dr. Atul Kamath. Chief author is Dr. Binita Gadabi.
SIEP'S.
Yeah, it's a SIEP'S test, a novel test to check wound integrity.
Good morning, everybody. I'll be presenting my paper on SIEP'S test, a novel test to check for wound integrity. I have no financial interest. Introduction. There is always a concern for the surgeon that leaving incisions without a definitive closure may increase the risk of wound leaks and further increase the chances of infection. So the SIEP'S test is a name given after the surgeon Stephen B. SIEP'S, who came out with this test. The SIEP'S test can assure that a surgeon has a watertight wound along with sterilizing the ocular surface at the end of the surgical case. Especially among postgraduates, this can be a boon where this test acts as a river bank for the outflow of aqueous, outlining the speed, location and quantity of the leak. The procedure is simple and straightforward, can be easily performed, and the findings are accurate. We use this procedure among all the residents training in ocular surgeries to detect any wound leak after performing the surgeries. So method, the study was undertaken in the ophthalmic department of Guru Gobind Singh Government Hospital, Jamnagar in a 12-month duration span. Informed consent and approval from the local ethics committee was obtained. 150 patients who were undergoing ocular surgeries performed by postgraduates were included, and any patient irrespective of age, gender or history of any comorbidities were included in the study, and all cases were performed after giving a peribulbar block. At the end of the study case, the globe is inflated to a normal pressure and the globe is confirmed to be firm by using a finger tension ballotment at the end of the surgery, and then 2 or 3 drops of betadine 5% is instilled over the wound. If there is any leaking aqueous, it is outlined by the betadine disclosing the clear flow from the eye, suggesting an aqueous leak for which meticulous wound surgery was done immediately. And all traces of betadine was flushed out to prevent any secondary inflammation, corneal changes or any discomfort to the patient or to the patient's eye. So the results are, out of the 150 cases that we saw, 110 patients underwent a small incision cataract surgery, 35 underwent corneal tear repair, and 5 underwent trabeculectomy. 66 patients had positive SIEP'S test, out of which 60 patients had usually a post-operative wound leak following a small incision cataract surgery, 4 were a post-corneal tear repair surgery which had a SIEP'S positive test, and 2 patients were after a overfiltering bleb following a post-trap case. And premature entry was the most common cause, comprising of around 45 cases or 75% of the cases, followed by floppy iris syndrome, which comprises of around 25% of the cases. And then there was a significant reduction in the number of resurgeries that we did after starting this test, where it was around 12 in the previous year, which dropped down to around 3 to the corresponding next year. Discussion. Study by Valenti et al. Found that wound leaks have 44 times more frequency of developing endophthalmitis due to contamination of the wound. And study by GSP found that in 100 cases, almost 1/3 of the incisions leaked. This was a study he did in phacoemulsification cases. And if the fluid is coming out at some point, most likely after a blink, the eye wound sucks in the fluid from the eye surface, leading to intraocular contamination. And one more study by Sletedal J.K. et al. Reported a case of iris prolapse through a clear corneal incision 2 weeks after a phacoemulsification case due to post-operative vomiting. To our knowledge, there is no study which helps us to identify leaks in procedures which have scleral incision like small incision cataract surgery. And especially among postgraduates, this can come in handy where a quick and efficient method can be done to identify the leak, and immediate post-operative suturing can be done on the same intraoperatively to prevent any leak. So concluding, cataract surgery is the most commonly performed surgery in the world, giving sight to millions. The need of providing maximum asepsis has led to development of guidelines and stringent aseptic precautions. So identifying this leak is of prime importance, which can help us reduce further complications. Especially in camp OTs, this can be handy where you can immediately intraoperatively find out if there is any leak. And the additional benefit of using betadine is that it also sterilizes the surface of the eye at the end of the surgical procedure. Therefore, SIEP'S test plays an important role in identifying any post-operative wound leaks for which immediate treatment can be taken. My references for this. Thank you.
Thank
Hello.
you, doctor.
Yeah.
Questions, please.
Thank you. Nice presentation. Who were the surgeons? Were they post-graduation, the students?
All the
All of them?
postgraduates, ma'am, who were learning intraocular surgeries. So it was done in them.
Second year, third year?
It was first year, second, all 3 years.
All three
Yes,
years.
ma'am.
So are you doing the SIEP test in all the cases post-operatively?
Sir,
Are you doing the SIEP test in all the cases post-operatively in a small incision?
if we suspect there is a premature entry, then we do a SIEP'S test, sir.
And other ways to detect it
And
without?
other tests can be can use a fluorescent stain. They are fluorescent strips, sir. But the additional thing is that you have to do it post-operatively on post-op day 1, and then again take back the patient for research.
On the table. On the table. If we put the air in the antechamber and try to push it from the opposite side, we can easily detect it.
Right, sir.
And when we perform the surgery, we are able to diagnose whether leak is there or not. It depends on how the tunnel is made by the surgeon.
Okay, sir.
Fine.
Thank you, sir.